Hi everyone, welcome to the Jobskin webinar series for 2024. The topic for today is when contours matter, what the Smart Scar Care Pad scheme and SilonTex can offer you in your practice. I'm Adam Ho, I'm the Managing Director of Jobskin. With me today is Rosemary Kendall, our clinical representative in Australia, and Veronica Eichmann, our clinical representative in New Zealand. With that, I'll pass over to Rosemary to kickstart the webinar.
Welcome everybody. We're delighted to have you with us. Actually, this is our first webinar for a while, so it's nice to be kind of kicking off the year with this. And we're pretty excited about the introduction of the Smart Scar Care Pad range. It's a bit of a mouthful. We tend to call it just SSCP because it's that bit easier. But I know probably a number of you have seen this, and it was first kind of shown in Australia in 2018, and then by the time the TGA process got started, COVID had hit. So we've waited about 5 years to be able to get our hands on it. So hopefully this information will be helpful for you in your practice. Okay, now I wonder, my screen layout for some reason is a little bit changed. Can I just ask you whether that slide has changed for you in the background?
Yes.
Yes. Yeah, beautiful. Okay. So really what we're going to look at today is just discussing when contours matter when we're talking about scarring, introduce you to sort of the details and the minutiae of the Smart Silicone range. We're also going to go over SilonTex. Again, some of you know SilonTex, some of you may not, and then have a bit of a chat about how to choose. And we've got some brief examples. Our aim with these webinars to try and keep them brief because we know they're often hard to fit into the day. So I've chosen examples that are short and sweet, basically, just to give you a bit of an idea about how these different products are being used. We'll talk briefly about ordering and make sure that you're aware of costing information. And I'm sure we can send the costing information to you after the webinar so that you have that all in writing. So let's talk a bit about when contour matters. Like, why are we talking about this? And I should probably say at the start, we're all well aware of Otoform. I'm sure, Otoform's been around for a long time and it's a very versatile and useful product. And there are some patients who when you look at these, you might say, no, actually for this patient, Otoform is my preferred option. And I'm sure that will be that you'll have some people for whom that applies. One of the limitations of Otoform, or two of the limitations, I should say, one is the rigidity of Otoform, and the other is the weight of Otoform. So, for example, if you put Otoform in the palm of your hand, you then lose a fair amount of movement and function, and it's a extra weight, which I'm sure you've all had feedback from patients saying, it's clunky and heavy. Having said that, there will definitely be circumstances where Otoform's your preference, but this provides you another option. So when the contours particularly matter is when you are really trying to obtain uniform compression, where you're trying to even out the variance in compression. And I would refer you to a webinar that we ran, I think it was towards the end of 2022, called Achieving Compression in the Body's Dips. And that explains a little bit more about the variations in compression. I think I talk about this a little bit later, but I might just cover it now. For example, when you put a glove on, if you are wanting to address compression on the dorsum of the hand, then actually 70% of the compression is on the borders of the hand, because it's not, the cross section of a hand is definitely not an oval. It's really very, very flattened, or not circular, it's very flattened. So if you're wanting compression in the back of the hand, then we're being a bit optimistic if we just say putting a glove on. And, therapists since time immemorial have been putting in chip bags to augment compression, but I'm not sure that everyone's always understood, myself included, initially, that I thought I was increasing the compression above standard compression, but in fact what we're doing is we are restoring compression in that respect. So it's important. That's an important kind of consideration. Obviously in concave surfaces, because if you put a pressure garment on and you've got a defect, then the garment just tents across and doesn't have contact with the areas that you're particularly wanting to target. We contours matter when we are wanting to protect. Someone's just got their mic on. I wonder if you could just mute that for us. Thank you. We obviously want to protect bony prominences, and as I mentioned when I was talking about the otiform, we want to ensure that there is little obstruction to movement as possible, and we want the silicone to stay in place. So that's obviously a factor that we need to consider. So let's talk a bit about the Smart Silicone range. Some of you may have had the opportunity to get your hands on it. We had it at the Hand Therapy Conference in Adelaide and also at the Burns Conference in Melbourne. And some of you may, in fact, I know a couple of hospitals in New South Wales were able to get some of this a little bit earlier, and possibly a hospital in Queensland as well. And if you were at the Burns Conference in 2018, you definitely would have handled it then. So this range of products was developed by Professor Celia Lee Chung, who's a research OT, very involved in researching of scarring at the Hong Kong Polytechnic. And obviously, being based in Hong Kong, the majority of patients that are seen there have an Asian skin type, and those of you who working regularly with scarring would be well aware that the Asian skin type is much more at risk of having aggressive hypertrophy. There's a higher collagen content in the dermis of with Asian skin type, so they're higher risk. So that's driven a lot of Cecilia's research and her problem solving with this, and it's really led her to develop this range. So what actually is it? If you have a look at that image on the right, the middle image, that's kind of if you look at it, just if you pick up a piece of the Smart Scar Care pad, that's what it looks like. But it is actually two layers. The bottom layer, so if you look at the graphic at the bottom of the screen, the bottom layer is silicone gel sheeting. And that is, that's not dissimilar to any of the other kinds of silicone gel sheeting on the market. But the top layer it's a silicone rubber that you cannot use the top layer for the contact with the scarring. That's not the purpose of it. But it's a honeycomb pattern of these rubber cylinders. Now, because it's cylindrical, it allows for movement. So just if I can ask you to imagine putting a square of that Scar Care pad in your hand, when you flex your palm, if you have something rigid in there, it limits the movement. But if you have a series of cylinders, the cylinders kind of compress in against each other. So there is not only is there the flexibility of the silicone gel sheet, which is standard for all silicone gel sheets, you've got this raising agent, which is then specifically facilitates movement or enables movement. So the layer of silicone, like any silicone gel sheet, adheres to the hypertrophic scar to limit the transepidermal water loss. That's something that's very familiar to us all, and it reduces friction. But why the studs? If those of you who haven't seen this before might be going like, why would I not just use a silicone gel sheet? let me just show you. I'm just having trouble advancing my slide there. Not quite. Oh, here we go. So in the areas where we need additional compression or where we want to shape the compression, the silicone rubber is basically a filler. In one sense, much the same as a chip bag, except that it is stable and it's linked directly to the silicone gel sheet. Plus, you can shape it. I would have loved it if I had a video to show you how we trim this, but you basically just take a pair of scissors and you very easily trim the rubber cylinders to shape it how you wish. If you are putting a square on, you do need to cut the edge cylinders on an angle, because otherwise you will have very targeted compression around the periphery of the square, and you actually effectively you reduce the compression in the center. So we actually are going for a bit more of a dome shape, but you get the sense here. You can see that these, can you see my cursor on the screen? They're beautiful. Thank you for clarifying that. You can see that these cylinders here have been trimmed down to shorten them so that we're getting this nice uniform compression over here. But where the scar is raised in the middle, it's been kept, the cylinders have been kept long so that we get that targeted compression there. So what can you use this for? Well, I'm really having trouble with my operating my screen today. I'm not sure why this is not doing that, but it's not allowing me to bring up my list of scarring here. There's something about the animations that seems to have been not liked the link with Teams, so I do apologise for that. But basically, you can use this for hypertrophic scarring. You can use
we can
it.
see that, Rose.
Can you?
Yep, it's just the full slide. Yep.
It's showing the whole list.
Correct.
Okay, I cannot see that on my screen. I wonder if someone else could read it, because I'm squinting to see the preview of about like, yeah, 1 millimeter high.
Yep. So the first one is hypertrophic scarring.
Yep,
the second point is aggressive scarring. The third one is augmenting areas of reduced compression. For example, the sternum, the dorsum of the hand, around the malleolus. The fourth point is for defects.
Yep.
The fifth is targeted compression. And then the last point is linear scarring.
Okay, thank you, Adam. I'm not quite sure why that's not behaving there. So can you see the whole slide now? I've got nothing here. So I'm actually wondering if I can just maybe bounce this back to Veronica and get Veronica to run through this, because I cannot see what's on my screen. So I apologise, everybody. That's not really what should be happening. And then I'll speak specifically to the trial examples a little bit further on. Is that all right, Veronica?
Not a problem, Rose. And you just jump on in any time you feel. So what form does it come in? Well, we have standard smart sheeting in 3, 6, or 9 millimeter heights. So the height refers to the cylinder height. And as I said, as Rose has said, each one of those is actually trimmable. We also have pediatric smart light sheeting. These are 3 millimeter high cylinders. So they are set at a smaller height to begin with. And then we have linear strips, which come in the 5, 10, and 15 centimeter lengths.
And what I would just say about the linear strips is that they have already been pre-trimmed. So if you have a look at that graphic there, you can see that the cylinders in the center are higher, but they've been modified in length towards the periphery of the scar.
Yeah, thanks, Rose. Next slide.
Oh, I'm back. I can see all the slide now. So I don't know what was going on there. But wait, there's more, just like the steak knives, because originally when we first saw the Smart Scar Care Pad range, when Cecilia first brought it to Australia in 2018, she'd only developed the pad range, and she's added 2 additional products to the range. And I must say, I've had the chance to play with both of these, and I'm secretly in love with both of them, and have found them extremely useful in my clinical practice. The first one is the Smart Pressure Bandage, which is this image down on the bottom right. And you can see that there is some perforations in there. You can tear the tape there, but that's not the primary purpose of that. But it is a medical grade silicone, and I would clarify that by saying it's scar management grade silicone, because there are a few silicone tapes out there which some of you may be familiar with. One of them, if I can use this as an example, and I'm not being critical of the product in any way, but like SilTape has become quite popular for scar management, but SilTape was actually developed as a retention adherent for fragile skin, like particularly in aged care where people can't have, Fixamol or those sorts of adhesive dressings on. The SilTape was used as an adherent tape for securing dressings, and it's become a bit more popular for use in scar management. I myself am yet to see any evidence that it is of a suitable grade for scar management, but I'm certainly happy to be corrected. But what I can say about the pressure bandage is that it is a designed specifically for scar management. And because of the perforations, when you apply a gentle stretch, and so that you have got some compression factored in with the silicone. So where you've got isolated scarring where a pressure garment is just not practicable, that's, for example, a small scar over the shoulder where someone's not willing to comply with a vest with sleeves on it for a small scar, then the pressure bandage is perfect for that. It's available in beige or white, and it is applied under tension. And I do have an example that we're going to discuss just a little bit later, where I'll just talk about some of the limitations that I have found with that, where it's useful and where it's where you have to sort of be mindful of how you apply it. And then there is this most amazing tape called the Smart Stretch Tape. And I would love you to get the chance to have a play with it, because it is a silicone gel sheet, but it is very stretchy. So this graphic here shows it wrapped around a finger. And if any of you had a little play with it at the hand therapy conference, possibly at Burns, if you wrap that round your finger like that, you can achieve a full flexion of the fingers without any constraint. So its stretchability is quite remarkable. And again, of course, it's a suitable grade of silicone for use with for scar management. So those examples that I spoke about where I've been playing with some of the samples, the first case that I just want to outline was a young woman who was involved in a traffic accident, and she had a really nasty laceration above her breast and a really nasty laceration below her knee. When I saw her, she became rapidly hypertrophic. I hadn't seen her at this stage. She went back to a surgeon and had those scars revised, and she was referred to me. Now, one of the issues with this woman was that she was extremely large-breasted. And so that scar was almost moving from a simple, uncomplicated surgical linear scar to a widespread scar in front of my eyes, purely because of the weight of her breasts. So we used the pressure bandage for her. It was an isolated scar, and in an area that it's very difficult to get adequate compression from a garment, particularly over soft breast tissue. And almost immediately you could see, like over a couple of weeks, that it was retarding that tension that was coming from her breast. She obviously wore a bra, but it was just able, much the same that we use taping for scarring, it was stabilizing that pull against the line of this, across the line of the scar to and applying silicone. So she's making great progress with that. On her knee, the scar went from the medial to the lateral aspect. It was almost 50% of the circumference of her leg. So it was a long scar, and it was just below the patella. Now, I was using the pressure bandage, a smart pressure bandage there again. And what I found was I had to be very cautious as to how much tension I applied, because that, coupled with the movement of the knee, meant that it was peeling up on the ends. Now, if you're applying it under a pressure garment, you don't have that issue at all. But that would be my one kind of probably just a little thing to keep in the back of your mind, that if you have got movement on the skin, considerable movement like close to a joint, you have to be very careful about the degree of stretch that you apply that. You still apply it under tension, but you have to moderate how much tension that you might use. Another one that I used the pressure bandage for was a scar revision on the anterior forearm. This woman was wearing a forearm sleeve, and if you've ever given someone a forearm sleeve, you'll find that they're often not terribly great at putting something on in the same place with the seam in the right area. So having SilonTex stitched into the garment was a little bit tricky, and so she was using that under tension under her pressure garment. Very simple to apply. Now, the reason I have put this particular example in is that because at this point when I tried this, I only had some samples. I had a limited amount of stock. The pressure bandage is, the manufacturer say that it lasts about, or any strip lasts about a week. You can take it off, you can rinse it much you would a silicone gel sheet, and that it's sort of expected to last about a week. She kept this one going for about 6 weeks, and it was looking pretty average by the end of the 6 weeks, but it was still adhering and still effective. So I can't honestly tell you that it will last 6 weeks, but I think you get good life out of that garment. Now, we did mention on an earlier slide about one of the tricky areas being around the malleolus, because if you're scarring, with burns, it seems to happen quite frequently. I know I've seen so many over the years where the burn the scarring is tucked in behind, particularly the lateral malleolus. Oh, sorry, I've typed malleola there. And you just cannot get enough compression. So we're often doing elaborate foam padding behind there, which may still be your best preferred option, but you can use the Smart Scar Care Pad as a way of raising that and minimizing that. So it's just such a perfect example. You just cut an L-shaped piece of the Smart Scar Care Pad, trim the edges and tuck that behind, and it will stay very stable. And the last example I would give you is of Dupuytren's, where you've got scarring in the palmar surface, where it's difficult to get compression anyway, and often the topography of a Dupuytren's repair is fairly undulating, but you can actually sculpt the surface of the Smart Scar Care Pad to even out that undulation so that you get even compression along there. And you can use either the linear scarring or the linear scar pad or the sheeting scar pad. All right, now we're just going to go through a little bit of a refresher about, we're just going to go through the costing for that. So the Smart Stretch Tape, its price that it's being introduced at is $46 for a 41 centimetre roll. The Smart Pressure Band is $57 for a metre roll. They're very reasonably priced. The linear strips are generally supplied with a piece of the pressure bandage as well, so that you can use that to adhere it if that's your preference. And they range between $57 and $80 depending on the length that you're using. And the smart sheeting varies in price based on the size of the sheet and also the height of the cylinders. The smart sheeting light is the pediatric sheeting that's got very low profile cylinders, and then the normal smart sheeting is the standard one that we showed you initially.
And Rose, just to
Yep,
clarify
go on.
that these are Australian prices,
Oh,
so
I'm so
slightly
sorry.
different for New Zealand.
That is absolutely right. Yep.
And also ex-GST.
Oh, and also ex-GST. Okay. I was not aware of that. My apologies. All right. So I think what we'll do is, Adam, if you're happy to send an updated price list to everyone who's on the webinar, that would be awesome.
Sure, happy to do so.
Okay, brilliant. And then there's still SilonTex. You still have that opportunity, and some of you are very familiar with SilonTex, as I said, some maybe not so much. Let me just clarify what it is. It is a thin layer of soft silicone. It is only 0.5 millimeter thick, but with enhanced durability, and it's unlikely to break down. And that is stitched into a compression garment. So it enables you to have the combination of compression and silicone therapy in one treatment. Now, there's obviously you as the clinician, when you're prescribing what you're going to do for your scar management, you're choosing a range of different things. But a couple of things I would just highlight. It lasts 6 to 8 months. I have to say, the first time I saw SilonTex, I thought, why would I stitch it into a garment if silicone only lasts 6 to 8 weeks? But in fact, SilonTex is very different. It's been made specifically for this purpose. So it's sewn into the garment. There's no additional care. You wash the garment as you would otherwise. It conforms well and it fits anywhere on the body. And you can use it in combination with padding or with inserts in the garment. So it's very versatile. I'm hoping, I can't see any of the text on this slide again. I can only see the image in the center. I'm hoping you can see that.
That's all that's on there.
That's all that's on there.
Oh, there is no, you can't see the text either?
No, not for this one.
Oh my gosh. There's something very bizarre that's happened here, because I can't click to add them and they were just all part of one thing. But we can send this image out to you too. But basically you can use it over anywhere in the body, and it's really helpful for getting into tricky places like around ears and under chins, web spaces, all that kind of thing, and along sort of dorsums of finger when you're trying to get gloves on. It makes it far easier to manage. Someone's just said the text is visible in the subsequent slides. We can see. That's awesome. Okay, fantastic. So now just a couple of practical guidelines with prescription. The manufacturer of SilonTex says maximum 50% circumference of any garment. Personally, in my experience, and practically, I would say 30% of the circumference is ideal, because otherwise, particularly if you're using a larger piece of SilonTex, because it's harder to don the garment. So if you're using it just on the dorsum of the fingers, no problem. If you have a near circumferential, say, burn on an arm, what I would consider doing is alternating the placement in 2 different garments, so that when they have got the first garment on, then maybe it's the a third of the circumference of, let's say, the forearm, and then their second garment, but they will have that over a different part of their forearm, so that they're alternating every 12 hours, and that makes it more effective. If you are stitching SilonTex into a garment, please give really clear instructions to the design team as to exactly where you want it. Either draw it on maybe take a photograph and draw it on there, or you draw it on a hand outline or a body outline your tapes in place, so it makes it very specific. But any information that you can provide is helpful for them. Just one brief example to show SilonTex. This particular gentleman had extremely aggressive burn scarring, and he had scarring over the thenar eminence and also over the dorsum of the thumb, as you can see there. So he had SilonTex stitched in over the dorsum of the thumb and onto the thenar eminence. You can hopefully you can see the outline. That's where the back of the SilonTex landed, and then over here, that's where it was. So it was just this piece of silicone. In this middle image, you can see it's turned back. And for him, it meant we had very targeted silicone therapy there. So that was very useful. In terms of costing, this is costed by the area of the SilonTex piece that you need. So it's not just a flat fee where you end up paying so much unnecessarily so much more when you're only needing a small amount. So we size it based on that area, and the designers will calculate the final cost. So now, how do you go about ordering? It's like whenever you're ordering a Jobskin garment, you always use an order form and the relevant measuring form. If you are ordering the Smart Scar Care Pad range, or the SSCP, you just need to email customer service at jobskin.com, or the Australian number is 03, or that number on your screen, and we'll arrange for Veronica to make sure that anyone from New Zealand has access to the New Zealand number there. If you need support from us, we've got a lot of resources, and I did refer you to one of the webinars that we've done previously about compression in the dips. There's a huge range of resources on jobskin.com. Plus, we have the YouTube channel, which is Jobskin ANZ. We upload all our past webinars there. You're welcome to view them anytime, obviously, because it's on YouTube. And we have some additional, like there's a keynote address that Jobskin sponsored at the Burns Unit a couple of years ago. Those sorts of things are also added onto the YouTube channel. Veronica and I are here to help. So if you have any specific clinical queries, we're happy to do that. Email is often the best option for getting to either of us. And if it's specifically about a garment that you're wanting to use, the design team are very helpful if you've got something that's a bit complex in its construction. Now, we've got a couple of minutes for any questions. If anyone has any, would be welcome to take any. If you just maybe pop them in the chat, and then Veronica will read them out.
Adam, I got all excited then. I thought that was one until it wasn't.
Yeah. All right. Well, look, if you don't...
I've got a question.
Oh, yeah, far away.
So I was busy typing, but I thought it was probably easier to quickly ask.
Sure.
Is the stretch tape, is it reusable? And if so, like how many times could you reuse it, do you think?
Yeah, sorry, I should have included that. I did speak about that with the pressure bandage, but completely forgot about that. It's comparable to the pressure bandage. It should last about a week of full-time wear. What I've found is that you can, you can take it off, you can rinse it, let it dry, reapply it. It seems to stay tacky for a minimum of a week, but it seems to be lasting a little bit longer than that.
Fiona had a question. Have you used the Smart Scar Care range in the head and neck region, and any experience with this?
Well, I haven't, Fiona, but I don't see any reason why it wouldn't be possible or wouldn't be helpful, actually, because oftentimes head and neck, the scarring is complex, and we often have elaborate arrangements with, otiform tucked in behind ears or in the submental area or around the neck. And I think actually both SilonTex and the Smart Scar care range would be very useful for that. I actually think the pressure bandage particularly because it's very versatile in its application. No problem, Fiona. Pleasure. Okay.
Does the silicone material does the silicone material effective in a pressure glove to help with deeper scar tissue under skin post hand infection with staph or post carpal tunnel surgery, or just use padding in the garment?
The silicone material, I think if you've got that really deep scar tissue, it works the way any form of silicone sheeting will be. Apart from the fact that it's very thin, the thinness of the silicone material SilonTex makes it very versatile and very conforming. But there's times where you just want to beef something up with a bit more targeted compression. And I think the silicone material won't do that. It will only provide you with the compression that the glove itself provides, but it won't enhance that. So for me, with that deeper scar tissue where I really want to apply increased pressure, I would be using either the linear scarring, if it's say post carpal tunnel, or the Smart Scar Care pad itself. I do think one of the real assets of the SSCP, the actual pad, is that you can really target your compression. I hope that answers your question, Leah. We've just got a comment in the chat. Kate has said, thanks so much. I've been waiting for this to come on the market since I saw it at the 2018 ANZBAR conference when Cecilia presented it. So exciting to see it finally here. I am with you, Kate. Me too. Like, we're just going like, when is it going to come? So we were really excited when we saw that this was coming on the market. So we're actually at Jobskin, we're delighted to have this as part of our product offerings, and it's something that works so beautifully in tandem with compression. So we were very excited. So yeah. Well, if we don't have any more questions, I think we do have another question. So, does the Smart Stretch Tape have much breathability? I wonder about skin integrity if it's covering a whole finger, especially in a hot climate. That's an excellent question, and that's something that we are yet to be able to really have been adequately tested. But what I would say is that I actually grew up in Hong Kong, so I know exactly how suffocatingly hot the humidity is in Hong Kong, and humidity is particularly difficult when you're applying something occlusive. I can't answer that question directly, but I do know that it was developed in that environment that's hot and humid. So I think we're going to find out. So I can't tell you exactly, but I would say over a finger, I would be maybe I would be, well, not just over a finger. I'd probably be a little bit select about wear time to start with and to see how people travel, and probably particularly sweaty bodies, definitely less.
I would I agree with what you say, Rose. I think it's about doing those initial development assessments and monitoring and just making sure you're heading in the right direction so that you don't cause any problem.
That, like any maceration or irritation. Yeah. Well, thank you for being here, everybody. Keep an eye out for our next webinars and email about our next webinars that we've got coming up. But it's been a pleasure to have you here, and we hope that this was helpful for you. I'll hand back to Adam.
No worries. Just repeating Rose's message. Thank you all for coming today. We'll be sending out other emails about our future webinars, and they'll also be on our website as well. And also, please do check out our YouTube channel. For everyone here, this webinar will be posted to that YouTube channel. We'll send you a link within about a week and a half.